The epidemic of mental health on college campuses. Mental health on college campuses is reaching epidemic proportions. 39%, or roughly 1 in every 3 students in college, experience a significant mental health issue. Going to college and having to be independent for the first time is an extremely stressful experience and can result in the emergence of symptoms like stress, depression, and anxiety. This can be overwhelming to deal with on top of the normal stress involved with being a student. College students perform tasks throughout the day, such as attending class, working part-time and full-time jobs, studying, and many are involved in extracurricular activities such as sports. All of this can be hindered by the mental health struggles.
Anxiety and depression are the two most prominent mental health issues seen in college communities. 44% of college students report having symptoms of depression. Of the 44% suffering from symptoms of depression, 75% will not seek help for their symptoms. The U.S. Census Bureau reports that in 2017, more than 18 million students were enrolled in college in the United States. According to figures compiled by Statista, nearly 3 out of the 4 of these students have experienced a sense of overwhelming anxiety at some time, and just under 30% report having felt overwhelming anxiety in the previous 2 weeks. Depression and anxiety are linked with lower GPAs, acute illness, increased alcohol consumption, dropping out of school, and suicide.
James Madison University, a 4-year public college in Harrisonburg, Virginia, is no stranger to the growing demand among college communities for mental health treatment and counseling services. They have seen a 36% increase in demand. However, they recently announced cutbacks to their counseling services, including less individual counseling sessions, resulting in an outcry from the JMU community. The JMU Counseling Center is an on-campus resource available for students who are struggling with the mental hardships of being a student. Services include individual and group counseling, outreach services, workshops, and an online program called Therapy Assisted Online, or TAO. On October 7th, the Counseling Center posted an announcement regarding changes being implemented as a result of ongoing high level of demand for clinical services and the limits of our resources. Penn State University, another public 4-year college, conducted a study about counseling resources on college campuses across the country and found that resources dedicated to routine treatments decreased by 7.6%, suggesting that students may be less likely to receive long-term care and attention after initial crisis counseling.
Cutbacks to services on college campuses, including those experienced at JMU this fall, have caused repercussions amongst college students. Lack of confidentiality and privacy when participating in group counseling services, as opposed to the complete confidentiality and privacy that a one-on-one session provides, is a major injustice caused by cutbacks. Not all mental health issues can be comfortably discussed in a group setting, and you may not be able to achieve the necessary goals. You may downplay your symptoms and lead people to believe it's not as serious as it is, and be misdiagnosed in the process. If mental health issues are left untreated or are inadequately treated, they could have lasting consequences that may potentially follow students throughout their postgraduate life and entering the workforce. This is an extremely stressful time for anyone and could seriously heighten previous mental health conditions. Why should you care about the mental health of others? Look around you. At least someone in this room has or is currently struggling with mental health. When you go to the mall or grocery store, someone there has struggled with mental health. If you visit a college campus in California, Texas, or any college campus in America, you'll find a significant portion of the community struggling with mental health, or maybe they've previously struggled as well. A solution that addresses the issue on college campuses lacking sufficient staff members in their counselling centres would be to provide internship and fieldwork opportunities for upperclassmen psychology students, as well as graduate psychology students. They could gain field experience working with students in the counselling centre, which would not only be great training for them, but would also free up the more experienced staff members to work individually with students suffering from more severe conditions such as depression, anxiety, and suicidal tendencies. The psychology students would have to go through an extensive application process to ensure the students chosen to work in the counselling centre are exceedingly qualified, because the main goal is to ensure the students are receiving the best help possible.
Mental health continues to rise in importance, and university presidents are starting to acknowledge the need for more resources. More than 80% of top university executives say that mental health is more of a priority on campus than it was 3 years ago, according to a new report released by the American Council on Education. University presidents have allocated more funding to addressing student mental health problems. 72% of the presidents indicated they had spent more money on mental health initiatives than they did 3 years ago. Mental health issues continue to burden college students nationwide. More strides need to be taken to ensure funding and resources are readily available to students because their futures depend on it. If you or someone you know is struggling with mental health, here are some resources to help you on campus and nationwide.